Trump set to announce fresh health care cost plan amid looming ACA subsidy expiry. President Donald Trump is gearing up to roll out a new health care cost plan as early as Monday, aiming to head off a surge in premiums that could follow the imminent expiration of key Affordable Care Act subsidies. The proposal, still under development, is intended to offer a viable alternative to the enhanced subsidies that currently support roughly 22 million Americans. It comes after Democrats blocked a month-long government funding deal, pressing for a clean extension of the subsidies. Senate Republicans have scheduled a mid-December vote to extend the subsidies through year-end, tying it to a short-term funding measure that stretches into January, while Trump's team crafts its own approach. Analysts warn that if the subsidies lapse, premiums could more than double and an additional 2 million people may lose coverage, creating a political flashpoint for the upcoming midterms. The White House has declined to comment, emphasizing that any details remain speculative until Trump makes an official announcement. Early reports suggest the framework could temporarily prolong the ACA subsidies but introduce stricter guardrails, such as new income caps and a requirement that every enrollee pays at least a modest premium. These measures target criticisms that zero-premium plans encourage fraud, while also setting the stage for a broader overhaul of the ACA. Republicans are pushing to reinstate an income ceiling on subsidies previously set at 400% of the federal poverty level removed in 2021. Simultaneously, the plan may mandate a baseline premium for all, aiming to curb fraudulent enrollment practices by brokers. Another likely element is an option for lower-tier plan participants to funnel a portion of federal aid into health savings accounts, echoing recent calls from Trump to channel funds directly to consumers rather than insurers. GOP Senators Rick Scott and Bill Cassidy have advanced parallel proposals allowing beneficiaries to redirect subsidies into HSAs, either for full coverage purchases or for paying health care services. A think tank-backed initiative would let lower-income enrollees shift deductible reducing subsidies into HSAs, with Congress potentially resuming funding for cost-sharing subsidies to lower premiums further. Additional conservative ideas could emerge, including expanding non-ACA plan options. In tandem, Trump is expected to urge Congress to codify a most favored nation drug pricing policy, building on his administration's voluntary deals to tie U.S. drug prices to those paid in peer nations. The final shape of the plan remains fluid, but its core aim is to balance premium affordability, fraud prevention, and greater consumer control over federal health care assistance.